Hello, welcome to our weight loss surgery seminar. My name is Dr. Mario Del Pino, and I'll be presenting some information about bariatric surgery, the indications for surgery, options of surgery, and what the process is to get weight loss surgery. So we performed the surgery at two different hospitals in the Rio Grande Valley area, Rio Grande Regional Hospital and Mission Hospital. I am the program director of this certified center of excellence. I have been doing weight loss surgery for 15 years. I did my fellowship in bariatric surgery at the University of Pittsburgh, and I performed over 2,000 cases. I train other people and teach them how to do weight loss surgery with a robot platform. And here we're going to start. So why weight loss surgery? Well, a lot of people try different diets and you lose 10, 20 pounds, but unfortunately 6 months, 9 months, 12 months later, you gain the weight back. Okay, some people have problems associated with the weight, like severe back pain. You cannot do your job, or you cannot have a good night's sleep. You have weight loss surgery and you lose a lot of weight and you feel much better and the back pain improves or even sometimes even goes away. Some people have conditions like diabetes mellitus type 2 requiring different types of medications, including insulin shots. Some people have high blood pressure, high cholesterol. And when we do this type of surgeries, a significant portion of patients get rid of all medications, and most of patients improve significantly. So heavy patients go through problems that a lot of people are not aware of. It's hard to find clothes that fit. It's difficult to bend over and tie your shoes. There's so many little things that we take for granted that are difficult for people who suffer from being severely overweight. Okay, and a lot of people who think about doing surgery are on the fence. They're afraid. They think it's dangerous. They think that it's just too hard, and it's not. Most of patients who end up having surgery say, "I should have done it sooner." Okay, little things that people enjoy doing, that you used to enjoy doing, you can't do them anymore because of your weight. Sometimes you want to be there for your kids when they grow up, because you know that if you're really heavy, your life expectancy is cut short on an average between 12 to 15 years. So some people make that big decision, and now you can go do the things that you like, enjoy life, and be with your significant others. Anyway, so why do we recommend losing weight? What is that people want to lose weight? Well, because when you carry excess weight, it's associated with many different medical conditions. If you're overweight, it's going to affect your entire system. You can develop high blood pressure, high cholesterol levels. You can become diabetic type 2. You can have a condition called sleep apnea, where you snore really heavily and you never get a good night's sleep and rest. You can have heartburn or reflux disease. From carrying all the weight, you're going to have pain in your knees, in your back, and your feet, and eventually those joints are going to go away, and you're going to probably need some kind of knee or hip replacement. Women have problems with their menses. They're too heavy, they're irregular, they cannot get pregnant, people get depressed. When you cough or laugh, urine leaks. And one thing that people are not aware of, cancer is increased. It's much more common in people who suffer from being overweight. That's why we recommend losing weight, because if you lose weight, those conditions can go away. Well, the problem is that when you are very heavy, when you're severely overweight, or when you're morbidly obese, you can try diets, you can try exercising, you can try different medications, and the best you're gonna get is a 5 to 10% weight loss. So let's say you're 250 pounds, which is being severely overweight, you're probably going to lose only 25 pounds. But the worst thing is that after a year, the chance of you keeping that weight off is only 2 to 3%. So 97% of patients who lose weight with diet and exercise or even medications, you check them again a year later and they gain the same or more weight. That's called the yo-yo effect, where you diet, you lose some weight, but then you gain more and it keeps going up and up and up. Okay, now let's talk about, are you a candidate for weight loss surgery? The first thing you need to understand is that it's not enough to know your weight to determine if you have a weight problem. We don't go just by weight. We use your weight and your height. And that, with those two numbers, we come up with a third number called body mass index, or BMI. So as in this picture, a normal BMI is up to 25. Okay, believe it or not. 2/3 of the United States population has a BMI of 25 and higher. If your BMI is more than 25, you're considered to be overweight. Once you reach a BMI of 30 or higher, you're considered to be obese. And once you reach a BMI of 35, you're considered to suffer from severe obesity. Okay? And here in the United States, if your BMI is 35 or higher, insurance will consider you a candidate for weight loss surgery. Now, that doesn't mean that insurance is going to pay for your operation, because not all insurance plans have that benefit. So, number one, if you want to use insurance, the first requisite is for you to have a body mass index of 35 and higher. So, this table shows, for example, if you are 5'4", okay, you need to be around 215 pounds to have a BMI of 35. If you weigh 210 and you are 5'6" in this case, your BMI is 34 or less, insurance will not cover for the surgery. Even if you suffer from knee problems, have diabetes, high blood pressure, it will not cover. Okay? In other countries like South America, Europe, even in Asia, weight loss surgery is covered at a BMI of 30 or higher, but not here in the US. Now, if you don't have insurance, or if your insurance doesn't have weight loss surgery as a benefit, or if you don't meet the criteria required by your insurance plan to cover weight loss surgery, you have the option of paying for that surgery, for that life-saving surgery yourself. Okay, so when do you become a candidate for weight loss surgery if you're gonna pay for that yourself? We ask patients to have a body mass index of 30 or more, as this table is showing. So, for example, if you are 5'2", okay, you would have to be around 165 pounds to qualify for weight loss surgery. Now, if you are going to try to use insurance, you have to find out if your insurance plan will pay for it. Okay, so that means that not all insurance plans cover or pay weight loss surgery. Okay, so for example, this is a very common, and this is no advertisement, but this is Blue Cross Blue Shield. Okay, so sometimes people say, "Doc, I have Blue Cross Blue Shield. Does that cover weight loss surgery?" That's not enough, because Blue Cross Blue Shield has many different plans. For example, this medical group or plan is called 471CHWN. And like this, there's like 100 different plans. So what do we recommend? We strongly recommend you calling your insurance company yourself. There must be a number here or in the back of the card. You identify yourself, you tell them your medical group number, and you say, "I want to know if my plan has weight loss surgery as a covered benefit." If they say yes, okay, the next step is to ask the insurance company representative who is on the line for a three-way call. So they have to call us in the office, 956-631-8155, so we can establish a three-way call, okay? And everybody's gonna be on the same page, and we're gonna ask for details. We're gonna ask whether your insurance plan covers, what are the requirements, and I'm gonna explain a little bit more about that. Now, we do charge $50 for insurance verification because we are also going to have to spend some time talking to those insurance people, usually 3 to 4 times. On average, each patient takes 4 to 5 hours of time going through all details and processes, okay? And sometimes it doesn't cover, so it's a lot of effort and time, and I have a couple people in the office exclusively dedicated to do this. And if we feel that if a patient is really interested in doing this, they have to be willing to pay us a fee, which is an insurance. It's like a registration fee, and it's valid for 1 year. Okay, so it usually takes us 1 week before we can call you back with insurance verification. Why do we ask for a three-way call? Because sometimes what happens is if you call and they tell you that it's covered, and we call and they tell us it's not covered, and when you and us get back on the phone and we tell you that it's not covered, and you tell us that they told you that it's covered, that's when the problems start. The number one complaint in our office, the number one reason for frustration for patients and for us, is when insurance company tells you one thing and it tells us another thing, okay? And we want to be absolutely sure that your insurance plan covers, because if we start the process going through all the evaluations, the lab work, tests, diet that can take up to 6 to 12 months, and let's say you're ready to have the surgery after you invested so much money and time, and the insurance says that your plan's not going to pay for it, you're going to be very, very upset, okay? It's happened before. We've been doing this for 15 years, and it's not us, it's the insurance company. So we don't want that to happen to you. Okay, so insurance verification is the first step if you're planning to use insurance. Okay, so let's say we did the verification, the three-way call, blah, 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 it's covered. Okay, so it's not just the BMI 35 or higher. Some insurances, or most insurances, require that if your BMI is between 35 and 40, you need to suffer at least from one medical condition that is related to weight, like diabetes, high blood pressure, sleep apnea, high cholesterol. Reflux doesn't qualify. Having problems with your thyroid doesn't qualify. That's why we have to spend additional time talking to the insurance plan and asking whether what are the specific requirements on that plan, because every plan is going to have different requirements, okay? It's a headache. That's the way it is. We don't make the rules. The other thing that we're going to have to ask them is this here, the need for medical weight loss treatment documentation. So what does that mean? It means that a lot of insurance plans request or require for you to receive medical treatment for weight, like diet, exercise, and have documentation of that for several months. It means that you have to go to a doctor or a physician assistant or a dietitian. You have to go once a month for 4 consecutive months for Medicare, 6 consecutive months for Medicaid. Some private insurances require 12 months of consecutive visits to a primary care physician or a dietitian before they will approve your surgery. And it's hard to get that. You're gonna get frustrated, okay? Now, we can't do anything. You're not gonna see me, I'm Dr. Pino, I'm the surgeon, until you complete this documentation, because a lot of times what happens is that people get 3 months and then they skip 1 month, and guess what? You have to start all over again, okay? And I'm not gonna be able to help you, see? So you have to complete all these requirements before we can even consider you to have surgery. Anyway, okay, so in the United States, everybody has to have at least a psychology or psychiatry evaluation and dietary counseling. Some insurances require you to have an evaluation by a registered dietitian, okay? A medical evaluation, sometimes it's enough to have me do that medical evaluation, but for example, Medicare, Medicaid, and some of the private insurances require your PCP, your primary care physician, to give us a clearance. Okay, so that's another thing we have to figure out before we start. So we're not going to be missing any documentation by the time we submit all these papers. Okay, just as an example, I mentioned Medicaid is one of the most difficult ones because they not only require you to go to see your PCP every month for 6 consecutive months and prove them that you didn't lose weight with diet and exercise or medications, but they also want you to see a heart doctor, a lung doctor, have an upper endoscopy, do a sleep apnea test, among other things. So Medicaid patients, we don't see them until they complete all the stuff, because otherwise we would never do any surgery and we'll be seeing patients all day long in the office. Okay? Anyway, so let's say you did all your evaluations that your particular plan required. You did the diet documentation. It's been 7 months that you've been working on this. We have to receive all that documentation. And we have to have the complete package before we submit all that paperwork to your insurance plan and have them approve your surgery. Let's say you are Medicaid and you have the cardiac, the endoscopy, the apnea test, the dietary, psych, medical, but we have not received your lung or pulmonology evaluation, or this doctor has not cleared you to have surgery. I cannot send the papers because you will be denied. Okay? And you don't want that, because then the only option is to go for an approval, and that's another headache. So we have to receive all the documentation before we send it for approval. I think that's the number 2 complaint. The number 2 complaint is that you went through all the visits and you keep calling our office because whoever did those evaluations tells you that they already sent the papers, but we didn't get them. And there's a lot of reasons why we wouldn't get them. They didn't dictate the report. They didn't print them, they didn't fax it, they faxed it to the wrong number, blah, 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 blah. It's the patient's responsibility to get all those papers into our office. We want to do your surgery. Okay, we're interested in that. That's what we do for a living. But we cannot send it unless it's complete. And believe me, I have 9 people working in the office just working on insurance verification, documentation, submission, and approval. Anyway. Well, let's say we completed the paperwork, we submitted it, and they approved it. Okay, so now you're going to choose your surgery date. And before we schedule you for surgery, every single one of my patients is placed on a specially medicated diet. We use these protein shakes, are very low in sugar, they have protein, and they're very low calorie. Okay, and why do we do that? Because when we go to operate, okay, we're going to operate on the stomach if we do a sleeve, also if we do a bypass. If all patients who have problems with weight have a big, huge liver. And this liver covers the stomach. When we do the surgery, we have to move the liver away to see the stomach and do the operation. But people who are heavy, like I said, have a huge liver. It's called a fatty liver. If you see it under the microscope, it has a lot of white spots compared to a normal liver that is small and has none of that fat. So heavy patients, we try to do the surgery, we have a very, very narrow window where we can see. And guess what's going to happen? The surgery is going to take longer. You're going to receive more anesthesia, and there's more chance of complications. So what does the diet do for this? When you're just on this low calorie, low sugar, high protein, special diet, your body is going to start eating away that fat, and the liver is going to shrink super fast. And now we go to surgery. The liver is very small. Okay, I move it and I can see a lot. I can see the whole stomach, and I can do the surgery much faster with less anesthesia, so that when I finish, you're going to wake up right away and you're going to be walking, and there's going to be less chance of, for example, blood clots, pneumonia, and all those complications that can happen with a long, slow surgery. Okay, the one thing that helps us the most to decrease the chance of complications in my book is this diet, so we can shrink the liver. I'm not asking you to do a diet to lose weight. I don't care about how much, if you lose 10, 15, or 20 pounds with this diet. I know that if you do this diet, your liver will shrink, the surgery will be faster, we will use less anesthesia, and you will have an excellent and better outcome. And it cannot be any shakes, because these are special formulated shakes that decrease the chance of